Ever wondered what those fancy acronyms like RBC, WBC, and platelets mean in your blood test report? Well, let's unravel this medical mystery together. We're diving into the world of complete blood count, more commonly known as CBC. This isn't just any blood test. It's a comprehensive evaluation of your health, capable of detecting a wide range of disorders. Imagine your blood as a bustling city, with each component playing a unique role. Red blood cells, or RBCs, are like the delivery trucks, transporting oxygen to every corner of your body. White blood cells, or WBCs, are the city's police force, always on guard against infections. Platelets are the repair crew, patching up any damage to your blood vessels. Hemoglobin and hematocrit? They're the city's infrastructure, determining the capacity and efficiency of oxygen transportation. Stick around to uncover the mystery behind these terms and understand how they can reveal a lot about your health. Did you know your blood is like a bustling city, with each component playing a crucial role? Just imagine, our blood is teeming with life and activity, working tirelessly to keep us healthy and functioning. Let's dive in and meet the key players. First up, we have the red blood cells, or RBCs. They're like the city's hard-working delivery trucks, transporting a vital cargo, oxygen, to every cell in our body. The more delivery trucks we have, the more oxygen gets delivered, keeping our body energized and ready to go. Next, we have the white blood cells, or WBCs. They are akin to our city's police force, always on the lookout for harmful invaders like bacteria, viruses, and other foreign elements. When they detect a threat, they spring into action, battling these invaders and keeping us safe from diseases. Then there are the platelets, the unsung heroes of our body. Think of them as the city's repair crew, always ready to fix any leaks. Whenever there's a cut or a wound, platelets rush to the scene, clumping together to form a clot and stop the bleeding. Of course, we can't forget hemoglobin. Hemoglobin is the cargo that our delivery trucks, the RBCs, carry. It's a protein that binds with oxygen in the lungs and transports it to the cells where it's needed. Without hemoglobin, our RBCs would be delivery trucks with no cargo. Finally, we have hematocrit, another key component of our CBC. Hematocrit measures the proportion of our blood that's occupied by these delivery trucks, the RBCs. It's like a traffic report for our bloodstream, giving us a snapshot of how congested our blood highways are with RBCs. So, you see, every component in our blood has a unique and essential role, working together like a well-oiled machine. That's why a complete blood count, or CBC, is so important. It gives us a detailed look at these components and how they're functioning. So, a change in any of these components can signal a problem in our body's functioning. A simple needle prick can tell doctors a lot about your health. And that's precisely where the fascinating journey of the complete blood count, or CBC, begins. Imagine this. You're sitting comfortably, rolling up your sleeve. A healthcare professional carefully locates a vein, typically on the inside of your elbow or the back of your hand. Next, a tiny needle punctures the skin. It may sting a bit, but it's over before you know it. This needle draws a small sample of your blood into a vial. This vial, now a carrier of precious information about your health, is sent off to a lab. Here, sophisticated machines and skilled technicians analyze the blood to provide an in-depth report. This report, the CBC, reveals key details about your blood cells, their count, size, and type, among other things. And voila, in a few hours or less, we have a detailed report of your blood components. So, when do doctors order a CBC, and what can it detect? Let's dive into the myriad of scenarios where a CBC might come into play. Routine health checkups are one such scenario. Just like checking the oil in your car, a CBC is a regular maintenance test for your body. It provides a general picture of your health, helping to catch any potential issues early on. Next, let's consider a situation where you're not feeling well. Maybe you're feeling fatigued, or you have unexplained bruising. These could be symptoms of a variety of conditions, and a CBC is often one of the first steps in diagnosing the cause. Now imagine you're already diagnosed with a condition, perhaps something chronic like kidney disease. Your doctor might order a CBC to monitor your condition and see how your body is responding to treatment. So, we've established when a CBC might be ordered, but what can it actually detect? Well, this humble blood test is quite the detective. It can help identify conditions like anemia, which occurs when your body doesn't have enough red blood cells or hemoglobin. Symptoms might include fatigue and weakness, and a CBC can confirm suspicions of anemia by showing a lower than normal count of red blood cells or hemoglobin. A CBC can also detect infections. When your body is fighting an infection, it produces more white blood cells. A higher than normal white blood cell count on a CBC can indicate that an infection is present. Clotting problems, such as hemophilia, can also be detected. A CBC measures platelets, the tiny cells that help your blood to clot. A lower than normal platelet count can suggest a clotting disorder. And let's not forget blood cancers like leukemia and lymphoma. These can cause abnormal levels of white blood cells, red blood cells, or platelets, which a CBC can detect. Lastly, immune system disorders can also be identified. Conditions like lupus or HIV can cause changes in your white blood cell count, which a CBC can pick up on. It's amazing how this simple test can help in diagnosing a wide range of conditions, isn't it? So, understanding your CBC isn't rocket science after all. We've taken a basic dive into the fascinating world of complete blood count, or CBC, a common and crucial diagnostic tool in the medical field. We've explored its components from red and white blood cells to platelets, each playing a unique role in our health. We've seen how a CBC is done, a simple blood draw that can unveil a wealth of information. We've discussed the numerous scenarios where CBC comes to the fore, aiding in the detection of various diseases and conditions. But remember, while we've broken down the basic components of the CBC, there is always more to know. It is not a tool for self-diagnosis. The interpretation of these results should be left to healthcare professionals who can provide a comprehensive analysis based on your overall health. Remember, every drop of blood tells a story. Make sure you're listening to yours. Your blood is a reflection of you, and understanding it is a step towards a healthier life. Thank you for watching. Like and subscribe if you're new to the medical field, and look forward to learning basic medical concepts in an easy-to-understand way.